Hi everybody, I can't see you but I hope you can see me. Yeah, today I'm going to talk about my perspective of being a service user researcher at Spectrum Centre in Lancaster. It's very much a personal perspective. I don't even try to sort of like say it's right or wrong because, as we all know, it's a very sort of new role. But what I'd like really is just sort of perhaps to introduce exactly the type of things that I do and just open the floor really for people to question whether they see the role of a service user researcher differently, or perhaps I've got experience of doing it in a different way. That would be great. So basically, I'm just trying to get this slide down, but it's not moving. Hang on a sec. I might need a little bit of help to move the slide on. It's done. We're sorted. It's just, yeah, thank you. So basically, as Erin said, we are a team of researchers based at Lancaster University who research psychological therapies for bipolar disorder. But not only do we research them, if the things we research we find positive, we work really hard at trying to get them into clinical settings so that people can actually access them. And I'll talk about a few of those studies later on. In Spectrum, we have a multidisciplinary team. We've got social workers, we've got people with lived experience, we've got psychologists, and nurses. So we do try and have people with a wealth of experience and expertise when we're studying. There they are, aren't they gorgeous? Very good. Where am I? Oh yeah, I'm on it. It's okay. Okay. So I suppose the best place to start is, what is a service user researcher? So as it says on the tin, it's a person who has lived experience of the condition. So in my case, it's bipolar disorder, and has an active interest in research. Now that sounds quite simple, quite straightforward. However, it's more than just living with the condition that makes you a researcher. And I'd like to sort of pose a few questions for you to have a little think about. So are all researchers who have lived experience of the condition, are they a service user researcher? Does this mean that researchers who live with the mental health conditions just have not come out? And what makes a service user researcher different to a researcher who has lived experience with a mental health condition? And I think these questions are really important to explore, because I know when I first got the job, I wasn't very clear about what a service user researcher was, and I'm sure my colleagues at Spectrum have done as much learning as I have on the way. Basically, a person who wants to be a service user researcher as opposed to a researcher actually is opening themselves up to using your lived experience as part of your job. So, for example, I'm going to talk to you a little bit about the Psycheducation Program that we did, or have done. We're just getting the research done. And basically, as part of that, we did things like life charts. Now, because I'm a service user researcher, it's an expectation that I would be able to perhaps use my experience of doing a life chart as an example for the people to use. But if somebody was a researcher, they don't have to do that. So that's where things really sort of, that's the big difference. It's actually, there is an expectation that you use your lived experience as part of the job. So as well, you utilise personal links with statutory and non-statutory organisations. Because you actually are a person who's actually living and breathing it, you actually may access, or I access, services like a psychiatrist or community mental health teams, and because of that I actually know what's going on and what's happening, and I've got links already there. So you're keeping the researchers at Spectrum really up to date with what's happening and what it feels like on the ground to be actually trying to access services and stuff. And encourage and support groups and individuals to get involved in research. I think that's a really, really big part of a service user researcher's job, because what I've found is people actually sometimes can relate more to a person who's actually got the condition, and there's an understanding of perhaps what the barriers might be. So as an example, one of the studies that we did, which was the IBPI study, which is an online intervention for parents who have a diagnosis of bipolar disorder. Now, because I'm a parent, I've got bipolar disorder, I had that little understanding about perhaps feeling like not having a lot of confidence and perhaps feel as though you can be criticised. So I was able to talk to people who may be interested in taking part in that study about it. It's not about being a bad parent. It's about, you know, sort of building on your parenting skills and perhaps building your confidence as well, as opposed to not being good enough. So, right, why employ service user researchers? I think it's obvious, but obviously it's not. It's quite new and not everybody does it. So let's have a little look. Interestingly, I think having a member of staff with bipolar disorder, so say me in Spectrum, I feel that people are always sort of like thinking about the language that they use, the terminology. They're aware that there's somebody around with bipolar disorder, and it just becomes like second nature. And I see this often at meetings. If you're in a meeting that's perhaps not Spectrum staff-based, but more sort of from a wider field, sometimes people say something and it's like, oh, I've forgotten. Oh, somebody's there. And you can actually see people bringing themselves back in order. Also, it's about having an understanding of bipolar from the inside, and breaking that down for clinicians and also people with lived experience. An example of that is I did a talk recently for some junior psychiatrists and GPs, and we were talking about a particular study that we were doing, and people, some of them said, oh no, I couldn't refer my patients to that, you know, they're not, you know, very stable at the moment, blah, 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 blah. And it was a lot easier for me to say, you know, please just give people a chance, you know, we're not pieces of glass, we won't smash, we're fine. Give people the opportunity. People can make their own decisions. And also, as researchers, we all know that we've got very, very clear guidelines in terms of keeping people safe. So, you know, refer them. And it's hard really for a clinician to turn around and say to me, well, no, I don't think we should be referring, when I'm actually one of those people and I would have liked to be referred. And ensure that our work is anchored in the priorities of people with perceived, who will receive the interventions. Now that, I think this is really, really important, because say for example at Crest BD we did some communications from some consultations on a web intervention that they're going to set up, and we do the same in terms of our focus groups, service user reference groups, etc. Now if you've got a reference group and that the consultations, and you ask people for their opinions, then they will give you an honest opinion about what's best for them. What they won't be giving you is shortcuts to save money, perhaps a tick box for your principal investigators. They're just giving you honest feedback, and really you have to be quite brave and quite confident to actually ask people for their opinion, because we know a lot of work goes into designing studies, etc., etc., and people really will just give you, you know, an honest answer, and what you get is real polished research in the end. And provide novel ideas and perspectives. Again, that's about people actually knowing really what they want and giving new ideas, and the things that you're not going to, you know, learn in a textbook, that you get from experience, your own experience, and being with other people as well who have lived with the disorder. Again, challenge perceived wisdom. I think it's very easy for somebody like me to actually ask anybody very direct questions, and I remember very early on in my service user career actually saying to one of the managers when we came out of a meeting, such and such a thing. And he said, like, why have you said that now? And I said, well, I thought it was obvious. And he said, no, actually, that's why we employ you, to state the obvious, because the obvious to me isn't always the obvious to other researchers. And helped cut through obstacles for engagement in research. By that, it's like, I often say, the group that I run in Stockport, I'll often talk about my work, what happens, blah, blah, blah. That's not while I'm working, that's because of just to do. And it's a way, really, of people sort of like learning about research, because there are a lot of barriers in terms of people's perceptions of what happens in research, and there's still sort of this myth of research is something that's done to you as opposed to done with you. So it's like that little rat wheel, and that the only person who gains is the researcher, and that is really out there. And I think that's a big part of my job, is to actually say to people that's really not what it's about. It's very much, you know, a two-way process, and sometimes you actually get interventions that are very hard to get on the NHS, etc. Also, it's easier for me to describe and disseminate findings in a way that's accessible, because we know, like, researchers disseminate their findings often through papers and what have you, and that's absolutely great. It has to happen, but really there's not much point in doing it if it's not actually going to get to the door of service users. So what we want to do, and what we are doing, and a big part of my job, is actually looking at how can we get our findings, disseminate the things that we're learning to people in, you know, in different ways. So, for example, it might be, let's have a think, what have we done? We did something called Campus in the Community, and what that was, it was a shop in the centre of Lancaster, and we had like a smoothie bike, and we had brilliant art activities. It was a really good day, or a couple of days, and it was a way of actually getting out of the university actually into the general public. And there were several people on that day from Lancaster who actually said, we've been meaning to get in touch with the university, but because it was a university and people see that as a very academic institution, which obviously is, and they didn't feel they could, but they'd come to the shop. So I think that's a really great way of breaking down sort of barriers, actually going out to people. And similarly, what I said before about keeping staff up to date with the real world, and an example of that is one of the studies that we did recently didn't have ethics to recruit in doctor surgeries, but actually from talking to people and being a person who accesses services, you know, I was being able to say to people, but a lot of people now in the system we've got at the moment in where I live don't have a psychiatrist. They don't go to secondary services unless they're really, really ill. So really we need to sort of like think about, you know, where people are, what ethics we get, and how to recruit. Right, I think it might be helpful if I just sort of talk about a couple of the studies, some of the studies that I've actually been involved in, so you actually get sort of a real sort of like perspective of what somebody like me, a service user researcher, would do on those particular studies. So the first one is ERP, and that's an online intervention, early relapse prevention from people 18 and upwards. Now, my involvement in that study was not at the very beginning, which would have been another service user researcher who would have been involved in the actually writing, you know, the grant application, the whole design of the study. I came in a little bit later, and mine for that was actually doing some videos talking about sort of my experiences and early warning signs and that kind of thing. So that's actually something quite practical. Also supporting people who were interested in doing some of the videos as well, you know, talking them through, you know, what they might want to say, what they might not want to say, which is as important. And also like that feeling of like, once you do it, it's out there, it's on the web, it's gone forever, you can't get it back, and how exposing that is, and just, you know, ensuring that people feel comfortable with what they're doing. And also in ERP, it was part of my job to bring a focus group together to actually monitor the study that was going along. And they were a group of 4 or 5 people who we've got meeting once every 2 months, but we're also in touch with them online for things that they're helping us with. So for example, one of my colleagues is doing some qualitative work on that study, and I was able to help him sort of like to get to talk to some of the people who were there. The focus group actually looked at the type of questions that I'd be asking, you know, how people might understand them, etc., etc., etc. So that's that one. Now the parenting study, the IBPI one, again, it wasn't something I was involved in right at the beginning, but there was service user involvement right from the beginning. And I think that's something that I've learned really quite quickly, really, is that I envisaged that, you know, you'd have this really momentum of the same person being right at the beginning, right through to the end. But, you know, life goes on, you know, people get other jobs, people move on, people might become ill, what have you. But service user involvement would still happen. So the focus group for that one, although it's a quite new focus group and it's come at the dissemination stage, it's still really valuable and really important. So if you don't get the same people all the way through, it's probably unlikely that you will, and perhaps, you know, how long it takes to get a study through, it can be ages, and then the actual study. But it's important to let people know that that's absolutely okay. You know, you're not tied in for life at Spectrum once you sign your name on the dotted line. So IBPI, with stage we're at now with that focus group, is actually coming to the stage of drawing the results together and dissemination. And that focus group will be helping me to actually disseminate the findings in lots and lots of different ways. And to be honest, you know, I probably couldn't come up with fantastic examples now, but you can bet your life when we get together they will. And that's really refreshing, you know, for me and for the staff team. And again, in IBPI, what makes it a little bit different for somebody like me, that's for parents who have a bipolar diagnosis. Having a diagnosis, like I said before, is having that understanding perhaps of the stigma that people may feel about being a parent with bipolar not being good enough, and actually being able to actually highlight that and actually speak to clinicians about when they're introducing the study to their clients, to actually be aware that people may feel as though you're actually giving them a good old telling off, when really it's not about that at all. So it's about educating the clinicians as well about how to speak to people and in what way. Now the recovery program, that's actually quite, when I say quite new, there's my involvement for this, which is a very new thing, is actually being part of actually the grant application, and that was something very new for me, but it was actually really, really interesting. And what I thought was really interesting about that was there's a box on the forms that we fill in England that says about your service user involvement, but what I was absolutely delighted to see is that on this particular application it had service user involvement all the way through. And I think that's a real telling sign that if you've got a tiny bit, oh yeah, let's put the service user involvement bit at the bottom, then you're not really committed to it, because really service user involvement is at the heart of everything that you do. It's got to be, and a little box might be an add-on, but it's not good enough. Now the last one is the parade study, which was an enormous study. It had psychoeducation, anxiety, it had one with the relationship between alcohol and bipolar, and a suicide study as well. I'm going to take you into more detail about the Psycheducation Program, because that's something that was the very first thing I was involved in, and I think it is a good example of how a person with lived experience might sort of like add something to a team. The rest of it is really interesting. We're just getting the results together, and again that will be about dissemination, you know, really actually getting to the heart of people who really want to know about it. Because at the end of the day, if people don't know about what we're doing, how can they ask for it? You know, I still meet people day in, day out who don't know the difference between a psychologist and a psychiatrist, and I didn't. I just thought it was like slightly different training. Everyone does the same thing. So trying to educate people and give them information about what is available and what you can ask for is a big part of my job. So there we go. Just gonna have a drink of tea. So the Psycheducation Program, which was, as I said, a big part of the parades, basically it was two separate groups, and there was about 6 or 7 waves or something. So in one group, people were offered 21 sessions of psychoeducation, and on the other hand, people were offered 21 sessions of peer support. And the idea is to actually look at which intervention is was the most successful, really, to enable people to stay well. The psychoeducation, the 21 weeks, was very much like based on Colin et al., who is a Spanish guy who actually ran the psychoeducation in Spain. The difference between the psychoeducation there and the one that we did is in terms of who actually ran the groups. In our psychoeducation and peer support, we had 2 health professionals, so that could be a psychiatrist, a psychologist, a psychiatric nurse, and a peer support person, which was me, and other people as well. Oh, there I am, stood at the front. Ooh. So actually, I'll go back to this because I'd like to talk in more about the psychoeducation and why, you know, what we learned really about having a service user researcher on hand. And I think for the psychoeducation, it was probably quite easy to understand why it would be good to have somebody, because we were looking at things like early warning signs. So I could actually do an example of your early warning signs, that life chart, and things like that. So the psychoeducation was quite good because it was a planned 21 weeks, and I could actually look at what the sessions were and think about what I wanted to talk about, and obviously what I didn't. And that is really, really important, because just because you're a service use researcher doesn't mean to say that you have to, you know, talk about everything that's perhaps happened to you, and you don't. You know, it's really, really important that people who go into this job actually realise that, you know, it's okay to set those boundaries for yourself. You don't have to be totally open and honest. In all things, it's absolutely fine just to say, no, it's not something, you know, I want to talk about. That's absolutely fine. As opposed to the psychoeducation, the peer support for me was much more challenging, because you just didn't know what was going to come up on the day. And there were times when I really got quite a jolt about some of the questions that people would ask. And because I was well at the time, people often would sort of like test me out to say, you know, have you been in hospital? Do you take medication? Are you still married? And things like that, to see sort of like all the markers, to really get the badge really of the bipolar badge, which was fine. I didn't mind that. But what was more difficult were being asked questions like, one in particular was like, what's the worst thing you've ever done when you're manic? And I was like, oh my God. And it was like a real jolt. And I think, you know, one thing that I would say to anybody who was going to be a service user researcher and to their managers is just ensure that there's really, really, really good supervision. And I was very lucky with my sessions, because I actually travelled to and from the venue with colleagues, and that was really helpful, because I could actually, if something was really worrying, I could actually debrief and what have you. So that wasn't actually, we had supervision built in, which, you know, with every, you know, research you have, but that was a week later, and for me it was always like I'd carry things unless I was able to actually debrief and sort of like put things to bed. So there we go. So let's move on a little bit and look at some of the challenges. And what I'd like to say about this is I think it's an absolute brilliant role. I think it adds a lot to research, but it is can cause quite a lot of friction, like anything new. Then things, needs to be, sort of worked out and what have you. And I'd like to really sort of challenge people really today to be actually really quite open and honest about, how the field role is, things that they perhaps think would be difficult or good or what have you. Because I think I just get the feeling sometimes there's a little bit of sort of like fear around the role, and people are worried about saying what they really think. And I have to say, that's a good part of being in a team, is actually being able to have those discussions and a little bit of conflict. I think that's absolutely fine. You don't have to treat us with kid gloves. So there you go. That's my challenge. So, from a university perspective, this is how I see it. In most jobs that you go into sort of at this level, there would be very clear roles and responsibilities, and sometimes for some people with bipolar disorder that actually feels quite safe, because you know what you're doing, you know if you're doing it right, you know if you're doing it wrong. But I think in this job, because it is new and managers are really sort of giving you sort of like the opportunity to develop the role, then that isn't always possible. You can't sort of like be developing and then work between these tram lines really. So again, it's about teamwork really, and being open and honest with your supervisors and your mentors about where you're going and what you're doing, and getting some feedback for yourself as well, because people with bipolar really like feedback, especially when it's good. And again, for academics, I think it can be quite difficult to actually learn to speak a language other than academic speak, especially if the service user researcher isn't somebody who's had an academic background, because some service user researchers have. I haven't, and that can be quite difficult for some researchers, especially if they don't quite understand the purpose of having a service user researcher, because like it says there, it's a new concept, and the benefits aren't always understood. And the thing is something we've sort of acknowledged at Spectrum is we know it's good to have a service user researcher, but knowing and proving are different things. And what we're sort of like now trying to develop is like, how do we actually measure the impact of having service user involvement as a researcher, and obviously our focus groups and our advisory panel, etc. And it's really difficult to sort of actually measure it, but we know if we're going to actually get funding for more researchers that we do have to, generate the case. So we're looking at that at the moment. Also challenging sort of academics to sort of think out of the box. I think further down I'll actually talk a bit more about looking at how do we actually measure people's abilities, because we know people with bipolar disorder are often high functioning, but also may, like I have, for whatever reason, had not actually accessed a formal education, particularly from leaving school. So how do we actually measure those kind of skills, those transferable skills, and do we want to do that? Because I know obviously universities have worked very hard to get their reputations, and the last thing they want to do is be seen to be watering down what they're doing. I've got some ideas about that, so I can tell you that in a bit. And also the lack of career progression. For me, when I've been in the role for some time, I think it's a really good thing to have something to aspire to, but also being able to get some sort of credit for your experience and the knowledge that you've gained. Because honestly, my learning curves have been like this, and I think it would be really good to actually be able to think about how we can do that. And I know that that isn't something easy for academics in institutions like universities, because we're very used to people climbing a very set of steps to get to, one level and the other, and it's very clear. And I can totally understand why people don't want to water that down. But we could do, there's a good model at Manchester University for teachers as opposed to lecturers, and a separate sort of scale. So there are ways around it. It's just thinking about how we do it, why we do it, and when. And there's more. Oh gosh, I made me a cup of tea. Yeah, I think I've touched on this already. Like, learning in the academic institutions is very much like very straightforward and quite easy to follow. And like with anything new, it can cause a bit of anxiety for people. People are precious about what they do. But I think, let's not be scared about having the conversations. I totally understand why an academic institution wants to make sure that they keep their levels in a certain way. Absolutely, totally get it. But as I said before, we can think out of the box a little bit and create something a bit different. And also the lack of career progression is sort of may actually stop people like service user researchers myself who could be very able actually applying for the jobs and actually keeping people with that experience in the jobs. So, again, another reason why we could be setting up some kind of tool so that people feel rewarded for their experience. And this one, a big handle with care. This is a massive one, and I could have just done a talk on this, is how to support staff who may be becoming unwell, and what are the implications for the rest of the team, if any. It's a really, really sensitive subject, and I know, from my behalf, the last thing I want is be seen to be treated differently. So, for example, if I started at Spectrum next Monday morning and I sit down, right, let's have a look, Rita, what's your early sounding signs, who do we contact, blah, 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 that can be like, oh God, like really not starting on the right foot. But what I would say to this is a lot of the things that I get from Spectrum about, could be classed as, sort of little tweaks to work, is all the staff have. So, for example, working from home, that's been really, really helpful for me, because sometimes if my mood dips, I can still work, but I'm a lot slower and probably later getting up in the morning, but I can still get my work done if I can do it from home. That's been great. What else is there? I can't think of them, but most of the things I would say are really things that can be applied to all the staff. And I think that the only thing that I would say about having somebody with something like bipolar disorder as a member of staff is don't rush in to speaking to people. Give the person time to settle in, and they will build relationships up with people. And it might not be the person, it might be the lady who comes in with the Hoover, whatever, it might not necessarily be the person that you have identified. And between them then, with that relationship, it becomes more of a natural sort of thing rather than sort of a big deal, like contact numbers on the wall if Rita starts going off, ooh, which would be absolutely awful. So it's about, for me, the only thing I can say about it is really about is that relationship and that trust, and, giving people time to feel confident in what they share, etc. So what are the challenges from a service user perspective? Well, the first one really does apply for me, and it's about, it was the first experience I had of actually being in a university, and it was like really, really exciting. I was really proud. The first day I went for supervision at Spectrum, honestly, I was like so delighted going through the doors, but also I felt a bit of a fraud, because it's like, as I said, my academic background isn't anything to write home about, and I was like, oh my God. So the university can be a barrier for people, and it's about breaking down those barriers and encouraging people to apply for posts and what have you by having imaginative job descriptions and stuff. Also, as well, there's no good practice template to follow, and that's really, I think that's a really good thing for me, because it's allowed me to actually develop things in a way that I feel comfortable with, and obviously through supervision and stuff. But for some people, especially with anxiety and stuff, it can be quite difficult to actually not have those like secure boundaries, you know, around you. But I think that's up to each institution really to work out for themselves. This is absolutely massive, which is the nature of the role exposes you to some very difficult stories. Are we finished? Oh yeah. Okay. Right, guys, I'm going to run through this quick because it's nearly time to finish. But I think I would definitely say to anybody who's actually going to apply for the job, and for those managers as well, really, really think about you know, the type of things that you can be coming across, and have good supervision in place to debrief and what have you. I mean, personally for me, I actually find doing the job really helpful in the fact that I know I'm helping things get better for the people in the future, maybe my children, what have you. So although it can be at times quite difficult, it's also very rewarding, and it, you know, actually gives me faith. Also think about doing some training for boundaries, etc. And understand that you will not please all service users. That's something I find really, really hard when people are critical, service users critical of what I do, because I want to be good for them, but it's not going to be the case, and that's not always easy. Be prepared to be challenged by other service users, and just be aware that if it's only one service user in a team, think about, you know, how they can get support from other peers. Like I do that on Twitter. And I'm just in the process of setting up a national peer support service. Did you need to? Let's have a look. Right. Okay. Finishing up. So where we're up to, well, in terms of service user researchers, so more organisations are getting involved with service user researchers, like Spectrum's got one, and like Crest employ people in a slightly different way, but they're still service user researchers. We're looking at a tool to actually measure the impact of service user researchers. We're including service users at meetings, academics, and actually observing the impact for themselves, so that if you've got a service user actually in a meeting with people that actually aren't used to working in that kind of sort of multidisciplinary way, it's a way of actually educating people to actually the value of including people. Right. I think that's it. And of course, yes, to end at Spectrum and at Crest BD, we've gone international. So thank you for listening.